Protests are happening from coast to coast today, some small, some a little larger. The organizers say they want to take a stand against what they call tyrannical measures and government outreach during this pandemic. Protests are being led by a group that calls itself the Canadian Frontline Nurses. Is that what they are? Well, we got Tim Guest, the president of the Canadian Nurses Association. He's in Halifax. Tim, I want to start just with the name Canadian Frontline Nurses. So this is a group that was founded by two people who are nurses. They do not work right now. They're not on the front line. Are you disappointed that name is being used on all their banners?
Oh, gosh, certainly. I'm hearing constantly from nurses across the country who are absolutely disgusted that these individuals would behave in this way. It is in no way meeting our code of ethics as a profession. They believe that nurses have worked for over a century to build very strong educational programs, regulatory colleges and processes, and common competencies, and we've worked very hard to be one of the most trusted professions by both the Canadian public and public abroad. And we can't understand why anyone who would be a nurse would participate in anything like this that would put that at risk.
So you're not the regulatory agency. That's something like the Ontario College of Nurses, which is investigating the two organizers who founded this. Of course, others have become involved. But because you're not the regulator, I can ask you a question more plainly that isn't under the guise of an investigation. Do you think these organizers should still be nurses? Should they be able to go back into a nursing function after taking this stand?
Well, we don't believe their behavior is professional in any way. We believe that their opinions that they are spreading out to the public are dangerous. They're not based in science or evidence. And we don't believe that is the activity that a professional nurse would do. I can tell you that I'm getting emails from nurses across the country that would very much like to see them never work again. And so I would say that nurses are not pleased with their activity.
Can I ask you just about these protests that we've been seeing, not just today, but over the past several weeks? And over those weeks, we've seen ambulances with emergency lights and siren on, trying to get into hospitals and being slowed down because of the protests. We've heard of instances where chemotherapy patients are inside hospitals listening to screaming, where dementia patients inside are scared because they hear yelling outside, where women going to a maternity ward try to get through crowds are being harassed. When you think about everything that you have heard about, do you agree that there should be, as the Ontario Nurses Association has called for, safe zones around hospitals where protests basically can't happen in the ribbon right around a hospital?
Absolutely. And this is something that nurses have been speaking about for many, many months. Long before any of these protests, we've seen an increase in violence towards healthcare workers over the last number of years. And this escalation more clearly supports what we've been saying for a while, and absolutely.
Alberta's Premier Jason Kenney actually talked about whether a new law in that province, the Critical Infrastructures Protection Act, something that was in some ways intended to protect against vandalism, against pipelines, whether it could be used by law enforcement. Do you believe that if there's instances where protesters are not being peaceful, where they're being disruptive, that a law like that should be used to make arrests of individuals outside hospitals and healthcare facilities?
You know, we put out a position when the first protest happened, and it's not about preventing people from speaking and being able to protest. It's about where it happens and the impact that it has. These activities happening outside of hospitals have had an impact in access to much needed care some of it for individuals who have waited a very long time. And it's absolutely aberrant that anyone would think that that was okay. And so we're very supportive of anything that the provincial and federal governments can do to ensure that there is safe passage and that individuals who need much needed care, some of it in an absolute emergency, are not impeded in any way by a protest that should happen outside of a legislature.
You put out a news release and said that nursing is a discipline based on science, not in a random gathering of personal opinions and ideologies, and that all opinions are not equal when it comes to public safety. Seems fairly self-evident, but what is the message that you're trying to send to those who would protest outside healthcare facilities?
I think what we're trying to say is that if you want to be a nurse, a professional nurse, we were educated and we practice in a science-based profession that uses evidence to support the activities that we do and the decisions we make, and that our personal opinions that have no scientific basis behind them have no business in the public realm that cannot be backed up by science. And that's what we're seeing with this group. So,
Tim, the people who are participating in these protests in many cities across this country, some may be healthcare workers. The organizers, this group began with 2 nurses, but many people are not healthcare workers. What would be the question you would ask them if you were face to face with them?
To me, I think it's why they would think that protesting at a hospital is the right way to go. I wouldn't ever want to get into a discussion with them about why they would protest at all, because there has to be an underlying reason about what they're unhappy about. And I think that needs to be understood. But I think there are better ways to do it. And for me, I would be interested in knowing why anyone would think it's okay to do it in that way. To me, that's what I find the most distressing, is that these behaviors are seen to be acceptable by this group. And it just seems like our society has shifted in a way that kind of boggles my mind.
Tim Guest, thank you very much.
My pleasure.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.